Hello, Ashley. Thank you for coming out, and let's get started. So, tell me about a time when you had a patient who requested support, and how did you balance safety and care?
Okay. Well, while caring for a patient experiences significant pain, the patient requested additional pain medication before the next scheduled dose. I first let the charge nurse know about the patient's pain level. I took the vital signs and I also asked the patient of the level of consciousness. So the nurse reviewed the medication administration record. After determining that administration additional medication was not safe without providing a order, they contacted the nurse and provider to discuss the patient's condition. As a revised pain management plan, they approved it and they let me know to continue monitoring the patients closely and educating them on the treatment plan. This experience reinforces the importance of balancing patients' comfort with medication safety and following communication standards.
Okay. Can you describe a situation where a patient's condition changed, and what steps did you take?
Yes. During the shift, I noticed a patient who had been stable became increasingly short of breath and appeared more confused than earlier in the day. I immediately communicated with the charge nurse and I reassisted the patient and checked the vital signs. I also monitored the oxygen and I documented them on the file. I notify the nurse and healthcare team to keep an eye on the patient and prepare any necessary equipment in just in case things get worse. Because the change was recognized early, the team was able to intervene quickly and stabilize the patient. This experience taught me the importance of continuous observation and rapid communication.
Okay. Can you share a time where you helped a patient connect with resources, and which organizations did you contact?
Well, I remember a patient was preparing to discharge and experienced a concern obtaining medications. So his concern was also for transportation and follow up care. I told him that I will talk to the case manager and social worker to have them with available resources. They connected with the patient and assisted programs, either clinical resources and to support services after discharge. They also helped to ensure the patient understood how to contact these resources. By coordinating support services, we help reduce barriers to care and improve the patients and families to manage their health at home.
Okay. Can you describe a time when you explained information to a patient with type 2 diabetes who did not understand their medical information, and what would you do in this situation?
Well, I would first access what the patients already understood about their type 2 diabetes and identify any specific confusion. I will also use simple words, non medical language, which I will explain how diabetes affect the blood sugar and why managing is important. I will discuss topics such as medication, healthy eating habits, exercise plans, and blood glucose monitoring and signs of high or low blood sugar. This will help them to ensure understanding, and I will ask the patient to explain the information back to me if there's any words, if if they had understood any words. If needed, I will provide written materials and involve family members with the patient permission. I will connect the patient with diabetes appropriate resources. My goal was to make the patient feel more comfortable, informed, and confident in managing their condition.
Okay. Can you tell me a time where you helped lead a new employee to new procedures or help them understand the workplace culture?
Yes, there was a couple times where I helped. new employees joined our team, and I was assigned to help orient them during the first few days. I demonstrated daily procedures, explained safety protocols, and showed them where to find our resources and documentations. I also introduced them to coworkers and explained how our workplace culture is, including communication, expectations, teamwork, and how we support one another. During our busy shifts, we also encourage them to ask questions, check in regularly to ensure they are comfortable, or if they have any questions about our patients. By providing guidance and support, the employees become confident in the role and integrated while we're there with our team.
Okay, that's all. Thank you, Ashley.
You're welcome.